And then we have the Finance and Performance Committee. Workforce Committee was the other one. And again, because of a number of changes that mid-staffs had to put in place in 2008 on the back of all the reports, most of the changes reflected around staff, be it recruiting more staff, training the staff, having a different skill mix of staff, getting them to work differently, getting them to work better, cultural changes. You know, nearly all of our actions that emanated out of the Healthcare Commission report had some impact on the staff in the organisation. So why wouldn't we have a workforce committee? I'm not sure why we wouldn't have had one anyway, bearing in mind, you know, 70% of our cost base is staff. Why don't we routinely have workforce committees? Because actually without the staff on board, you're going to achieve diddly squat. So why aren't we giving it the profile that we should have? So again, we put a workforce committee in place. So finally from me, some personal reflections on my time in mid-staffs, and I guess subsequently in my time with RSM Tenon as well, really, going around a number of organisations. Have we learned? To a degree, I think the answer is yes, but I don't think we still get it really. I don't think every organisation does understand what it means to deliver quality care. I certainly don't think every trust in England can assure itself it's delivering quality care. I still don't think they necessarily know, many organisations still don't know their ward establishment, they don't know their skill mix on wards, etc. They don't know about some of the basic nursing indicators and what level of performance they're delivering against those. There is still something, and Manjit may touch on this a bit more as well, certainly Manjit and I have had a number of conversations about this over the years really, around the informal corridor conversations, and we had a lot of that at mid-staffs when it all came out. You know, a number of people wanting to grab you in the corridor and say, off the record, can I just say? And the problem is it's not off the record, because you've now told me, so I know. So I can't not react to that or respond to that. So actually we need to get away from that. Off the record, can I just say? And there's too much of that going on at mid-staffs, where people wanted to make a point but weren't prepared to stick their head above the parapet professionally and say, as a professional with my duty of candour, I need to tell you. They took one step short from that and said, actually, can I just tell you off the record? Well, actually, it goes back to conversation about is, if you tell me, I will have to do something about it. So just think, you know, do you want to tell me or not? Simple as that. And I think there's still too much of that going on. I mentioned earlier about how we were far too dismissive of Julia Bailey and others in the same boat. And we dealt with some of the complainants appallingly. And we saw them as an irritant. We saw some, frankly, as being barking mad and that will never, ever satisfy them. So why do we bother trying? That's not acceptable. We were far too dismissive of them. Actually, our job was to sort the wheat from the chaff and understand that even if there is a 6-page rant of a complaint letter, within there will be some nuggets that we need to drag out and look at and take seriously. So it's about sorting out the wheat from the chaff at times. We didn't deal with the pressure group properly. We didn't bring them inside the tent. We didn't take them seriously. And therefore, it became adversarial, and a very adversarial relationship with them. And that's not good. Not a good place to be at all. And we did the same with the local media as well. The local media decided to start to target the organisation, and we didn't respond in a positive way and try and bring them inside. We didn't try and educate them. We didn't try and bring them on board and explain what we're trying to do. And again, they're very powerful bodies if we're not careful, and they do need managing. And we shouldn't underestimate the amount of time and effort that takes as well, really. We still try and pass exams in the NHS. People still see foundation trust status or compliant care quality commission visits as an exam to be passed. And we gear up for that exam. We revise weeks beforehand or months before. It should be about, if we're providing good quality, effective care, we'll get through. It should be about the day job. If we're doing the day job right, the rest of it should be a kite mark. It should be an accreditation of what we do, an appreciation or recognition. We should not be aiming to pass exams because it means we're not doing the day job right. question the assurance more as well. And certainly now in mid-staffs, there's a lot more check and challenge going on around the data that's being routinely presented throughout the organisation. So when we say we're doing stuff, we say we're compliant, we go back and check. You know, and even if it's just sampling a few patient records, if it's just pulling out in 2 wards 5 or 10 sets of notes, we all go and do sampling just to check and verify the quality of the data that's coming through. So actually we can't then use that as an excuse going forward, say it's poor quality data, or we respond in such a way because we believe the data. Actually we test the data, go and check it. So you know, I think generally mid-staffs and certainly more organisations now are getting better at that triangulation and joining the dots up in terms of looking for different levels and different indicators around. So if there's noise over here, and there's noise here, and there's noise there, well, let's start understanding that bigger picture and joining it up in terms of what might that mean. Talk to you about the prioritisation of the big picture stuff. We do get far too easily distracted by stuff. There's a lot to achieve. I think at the board level or at senior management level, it's about prioritisation and focusing on what's important, and using your committee structure, using your divisional structures accordingly to delegate down where necessary and where appropriate. We still get a lot of defensive practice. And when I read and do desktop reviews of board papers, board reports, there's still a lot of optimistic bias the way papers are written. There's still a lot of we're no worse than the next person, or we're at average within our peer group. I'm not sure I want to be average. I'm not sure I want to be part of an organisation that delivers average. But we still use that far too commonly at times in the organisations. There's something about spin, and in my travels at RCM Tenon, I've told one other trust that I felt they could possibly be the next mid-staffs. I was really, really concerned about certain aspects of their care, their nursing ratios, their skill mix, some of their equipment issues, etc. There was a whole number of points that led me to believe I was really worried about them. The Chief Exec's response was, "You're not going to put that in the report, are you?" Then when I said I was, because having been through the public inquiry at mid-staffs, I'm going to write everything down and cover myself, because I've learned. His response then was, "Can you give me a second report for my eyes only?" How does that give me confidence that actually he was going to respond and react to that in a positive way? Not at all. So there is still this thing about spin, about perception, and wanting to manage messages rather than actually sort out problems and issues and be more honest as well. Culture change. Easy to say, extremely difficult to deliver. It takes money, capacity and time, and lots of it. And I'm sure Manager and Colin will give a more up-to-date view around the culture at mid-staffs now. But, you know, it takes absolutely years and years to achieve, and it's not easy. I'll leave that for Manager and Colin to touch on in greater detail. And finally, going back to the point I made earlier, still people see the decision to do something as the end point, as opposed to monitoring the consequences of that, and whether we've had unintended consequences or it's actually delivered the intended consequences of what we wanted it to deliver. Too often at boards and at senior teams, we take an action or make a decision and we're like, right, great, we've done that decision, what's next? And actually, where's the feedback loop? Where's that kind of check and assurance that it's going to have that impact and that assurance? So I think my final comment really is I just don't think within the NHS we hold the mirror up to ourselves enough. I don't think we question ourselves enough. I don't think we question our team enough or our organisation. We're too readily accepting of issues and of things. So that's some of my personal reflections of mid-staffs as well.